patients need to know that we are adult center, because a lot of sickle cell patients still are adult and they still go to pediatric programs. Some programs, they do have adult pediatric, then and then some insurances allow, many insurances allow patients to stay with their pediatric program up to, I guess, 25 or something. So they stay there until then they get transitioned. And then there is still some issues with transitioning, like even in good, very, established sickle cell centers, it's not as good and as they think. Like patients still are not ready. Some of it might be patient issues, cognition problems and things like that, some sickle cell patients do have because of having a stroke or having a silent stroke. So, they still need somebody hold their hand and make the appointments for them, bring them in, remind them. And they're not used to, oh, now my parents backed off, I'm alone myself. See that, yeah, you see that a lot. And because during the pediatric program, everything, there is a perfect setting, insurance covers everything. So patients have less effort to making appointments and things because there is a coordinator already in place, arranges everything for them. So it's a little bit hard when you come from that environment to a new adult program that everybody expects you to know everything and do everything yourself, basically. And then also it's a little bit hard to get this concept in the adult program to help the ancillary staff, people who help you in clinic, understand that these adults are different from other adults you see. They have, they have needs that other adults don't because of the kind of disease these patients are. Because if they have a lot of pain and they are on, narcotics chronically, that by itself affects your cognition. Like if you call them 6 in the morning, trying to make appointment for them 8 in the morning, this patient always wakes up like 11 o'clock, right? So then it's not gonna work. You need to work with patients' schedule. That's one thing. And then also, I think we need more resources for adult programs who deal with, in general, chronic non-cancer blood disorders, because similar to pediatric programs that these patients initially start with, we also need coordinator. We need to make sure we get paid for the time we spend. So reimbursement is very important, how patients with classical hematology disorders get reimbursed versus malignancy patients, right? Because these are, and then right now the billing has changed, and now you bill based on acuity of the disease, right? You can also bill by time, but that's another discussion.